In the news, we'll hear about results from a study on the accuracy of biopsy strategies for detecting prostate cancer, as well as data from a trial on treatment for metastatic castration-resistant prostate cancer. And today, we'll start a regular weekly feature on the news. We will provide you with highlights from one of the numerous online educational activities available at OncLive.com. Hello and welcome to OncLive News Network. I'm Laura Jones. First, a report in the January 27th issue of the Journal of the American Medical Association describes a National Cancer Institute study on varied biopsy modalities for diagnosing prostate cancer. Dr. Raul Concepcion, a urologic surgeon from Nashville, Tennessee, describes the study, the results, and the key message for community urologists diagnosing and treating patients with prostate cancer.
In this prospective clinical trial, 1,003 men had lesions identified on multiparametric magnetic resonance imaging. These men then underwent a targeted MR ultrasound fusion biopsy performed by one physician, followed by a standard extended sextant biopsy performed by another physician who was not aware of the MR lesion locations.
Basically, what they found was that in terms of the number of cancers found using targeted biopsies versus systematic or 12-core biopsies, the number were the same, but the use of targeted biopsies identified more high-grade significant cancers, which is what the goal is of using multiparametric MRI. And the reality is that they also did not miss that many low-grade cancers, in other words, Gleason 3+3. I think it's important for the community urologists, whether they be in large groups or small groups, to understand that the current system, the current technique of biopsy, especially in light of the fact that we are endorsing active surveillance, is really suboptimal. And the ability to use multiparametric MRI and fusion biopsy presents a significant advance in the ability to accurately diagnose which patients have significant prostate cancer and therefore should be treated.
In the setting of metastatic castration-resistant prostate cancer, the Phase 2 Terrain study reported top-line results from its head-to-head trial between enzalutamide and bicalutamide. In the study, enzalutamide was the clear winner, demonstrating a statistically significant increase in progression-free survival of nearly 10 months over bicalutamide. Serious adverse event rates did not differ greatly between the two treatments. Although there are currently no plans to conduct a Phase 3 trial, results from this trial may further guide oncologists' treatment decisions in this population. Further analyses of the Terrain data are being conducted and will be submitted for presentation at a future medical conference. Data from the response trial on the use of ruxolitinib for patients with polycythemia vera were officially released this week in the New England Journal of Medicine. 222 phlebotomy-dependent patients with splenomegaly were randomized to receive either ruxolitinib or standard therapy. The primary endpoint was both hematocrit control through week 32 and at least a 35% reduction in spleen volume at week 32 as assessed by means of imaging. As reported earlier, ruxolitinib was superior to standard therapy in all the measures assessed. Ruxolitinib was approved by the FDA in December 2014, and now the Committee for Medicinal Products for Human Use of the European Medicines Agency has endorsed ruxolitinib as a treatment for adult patients with polycythemia vera. If approved, ruxolitinib would be the first targeted therapy for polycythemia vera in Europe. Finally, we are pleased to highlight our OncLive Insights program, Metastatic Melanoma, Current Treatment Strategies and Future Directions. In this program, Drs. Howard Kaufman and Robert Baca discuss important issues related to metastatic melanoma. They cover diagnosis, including imaging, biopsy, and biomarker testing, treatment options, including immunotherapy and management of brain metastases, as well as emerging therapies and administration strategies. This interactive publication allows viewers to select specific topics to tailor information to individual learning needs and preferences. To access this informative program, visit oncolive.com/ipub-melanoma. And that is the news for this week. I'm Laura Jones. Thanks so much for joining us on OncLive News Network. We'll see you next time.